if you know someone suffering from fibromyalgia, then you know how painful it can be. And today we're going to get a little deeper into the topic, and we're going to be answering some of your questions. So before we move on to talk to Dr. Alex Bigham, I wanted to let you know you can go to our website at sonoranliving.com and click on House Calls. As soon as you ask your question, Dr. Bigham is going to be here through the show, so we'll be able to answer them. So I guess that's why we call it House Calls.
That's right.
All right. Well, welcome back to Sonoran Living.
Thanks.
What exactly is fibromyalgia?
So a chronic pain syndrome, and more people are being diagnosed with this. Part of it was that we're getting better at diagnosing it. But there seems to be just a larger percentage of the population, mainly women. Women get this problem 10 to 1 over men, but men and women both can get it, and you can really get it at any age, but it tends to be women in their 20s, 30s, 40s that tend to come up with this.
Now, when you say it's pain, are we talking like joint pain? Are we talking you wake up and just your whole body's in pain? Is there a certain area?
Well, no, it does tend to feel like an all-over body type of pain. It usually has to be for 3 months or longer of duration. It oftentimes feels like it's coming from around the joints, but it's actually coming from the white connective tissue that kind of envelops our muscles. And I think we have a good graphic on the white connective tissue of fibromyalgia. Okay. You know, when you think about muscle, you don't really necessarily think about how it's really enveloped and compartmentalized, but we have lots of small groups of muscle fibers that are surrounded by white connective tissue, and then those are bundled together with more muscle groups that are then enveloped with more white connective tissue, and then the whole muscle is enveloped with white connective tissue. So that is really where the pain originates from, but a lot of times it does feel like it's coming from the joints, but it's not.
How do people know that they have it?
That's the big thing with fibromyalgia.
That is the million-dollar question, right?
Yeah, there's no real, lab test or diagnostic that you can do to say, hey, and pinpoint it, I've got fibromyalgia. It really is up to the physician doing the examination. It's going to come from a good history and a good physical exam, and the exam has to include what we call a tender point examination, because there tends to be about 18 specific points where on everybody that has fibromyalgia, they tend to be much more sensitive in these areas. We call fibromyalgia a pain amplification syndrome because when you press on these tender spots, it produces much more pain than it would in somebody who's healthy.
So do you just get the people into your office and basically start?
That's right. So we're going to go through a history with them, and then we're going to check all of these 18 spots, and if 11 of these 18 come up with tremendously more pain than they should, that's a pretty positive diagnosis for fibromyalgia.
Now, what else accompanies the pain? I mean, obviously there's pain, but is there anything else that would sort of give a person an idea that that's maybe what they have, or at least they should come see you?
Unfortunately, yes. A good percentage of patients that have fibromyalgia also have chronic fatigue, which is huge. That's the combination of feeling like you have pain all over combined with being incredibly fatigued is a real 1-2 punch.
Okay.
And so the other thing that often goes along with this is depression.
Okay.
Depression is huge, and a lot of times it's because they just feel like they are becoming unable to cope with just the normal activities of daily living. One of the things that goes along with it is called fibro fog, actually, and it's just this brain fog where you just have difficulty, and here's a great graphic that illustrates some of the components of fibro fog. Do you have difficulty recalling the word that you want to use in a conversation? Do you have short-term memory problems? Directional disorientation, that refers to, when you're trying to find your way around town. Are you getting lost easy? Multitasking difficulties. Do you start a task and then get distracted and forget what you were originally going to do? Do you walk into a room and forget, why was I going into this room?
I feel like I have that all the time.
Confusion and trouble concentrating. Do you have difficulty processing simple information? And then simple math things. Do you have difficulty, adding simple numbers together and performing simple math things? This fibro fog is becoming one of the most disabling components, actually, of fibromyalgia. We always think, okay, fibromyalgia is a pain problem, but we have more and more people claiming disability as a result of fibromyalgia than in any other time in our history, but it's not necessarily due to the pain, it's due to the brain dysfunction, the fibro fog. They're unable to sit down at their desk and do the normal things that they need to do at work, and as a result, they're becoming disabled. They're
it's like
not able to function.
A blank screen that just goes across your face.
So it's difficult. They're just not, they can't be productive in the workplace, and therefore they're being let go from jobs, or they just feel like I'm not competent at my job anymore. That's
well, let's go
huge.
ahead, and I know that there's people sitting out there and they might have a question. Maybe they feel like, he will never get to me. So go ahead and email us. Just go to sonoranliving.com and then click on house calls, because you're going to be here through the hour.
Yeah.
And there's no such thing as a stupid question.
Right.
I ask them all the time. Trust me, there is no such thing. We want to let you know more about Novocur Pain Management Clinics. They have 2 locations in the Valley, and for more information, you can visit novocur.com, or you can give them a call at 480-855-NOVO, which is 480-855-6686. Again, if you have a question about fibromyalgia, let us know. sonoranliving.com, click on house calls. And Dr. Bigham, he's going to be here throughout the show answering your questions, so we'll be back in just a few minutes. That sounds good. All right, we are back with Dr. Alex Bigham from Novocur Pain Management Clinics, and we're answering your questions. Lots of people are emailing us in. We're going to get to a lot of those questions. Here's a question. So you have the fibro fog, is that what you call it?
Right.
How do you deal with that? Like, how do we fix that? Because
Yeah, great
I
question.
mean, that seems like
Right, that's
it would be
the
tough.
million-dollar question, right? So what we know is that the fibro fog gets worse as the fibromyalgia pain gets worse.
Okay.
And so if we can deal with the pain, if we can get the person's pain under control, that those fibro fog symptoms are going to diminish. So the key is with all fibromyalgia issues, whether it's the pain, whether it's the chronic fatigue, whether it's the fibro fog, whether it's depression, got to get these people to the point where they're moving again, back to being able to do some even light exercise. So the key is what can we do to get them back to light exercise, and starting with very short duration of exercise. We're talking maybe 5 or 6 minutes.
Okay.
And the temptation for all these fibromyalgia patients is to just jump right back into their normal exercise routines, like I'm going to go to a 45-minute aerobics class. It's too much. It exacerbates the pain.
Little at a time.
Right. So 5 minutes, and usually swimming or yoga are the 2 best things to start with. Start with very short duration and work your way up.
Okay, and we're going to have more questions. Thank you for that answer. Still ahead, we have a couple more minutes here with Dr. Alex Bigham. So go to our website, sonoranliving.com, and then click on house calls on the right side of the page, and then Dr. Bigham will be here to answer those questions in just a few minutes. Oh, they're so cute. All right, we are back with Dr. Alex Bigham from Novocur Pain Management Clinics answering your questions about fibromyalgia. And here's a question from Paula. She says, is it similar to rheumatoid arthritis? I was diagnosed with RA, and for some reason I feel like I have more fibromyalgia symptoms that you described. So what, should she seek another opinion?
The symptoms can feel similar, but rheumatoid arthritis, RA, really does affect the joints, whereas fibromyalgia only affects the white connective tissue that we discussed earlier. With RA, there are specific lab tests that you can do to confirm the diagnosis. So that's one of the things that we do. If we suspect somebody has fibromyalgia, we want to rule out things like rheumatoid arthritis, and we can do that with specific lab tests. So she probably, if she's questioning it, she might want to go back to the doctor and verify that the lab test had been appropriately run to definitively diagnose her rheumatoid arthritis versus fibromyalgia.
Now, is there pain with rheumatoid arthritis?
Absolutely.
So, and you can help that as well, right?
Yeah, and at Novocur, that's one of the things that we can do. Some people can't get to the point with fibro where they can exercise, and that's what we do at Novocur. Is we have a non-steroidal injectable treatment that can dramatically bring down their pain levels to get them to the point where they can exercise to start bringing down their symptoms.
Okay, so it sounds like a second opinion is good with her doctor or another doctor, or you guys, of course.
Absolutely.
All right, so if you have a question about fibromyalgia, let us know. Head to sonoranliving.com, click on house calls on the right side of the page, and Dr. Bigham will be here throughout the show answering your questions. I'm glad I did it on the air. All right, we are back with Dr. Alex Bigham from Novocur Pain Management Clinics answering your questions about fibromyalgia. And a question that I have, actually, because I know I have friends that have it, how soon, once you come in and they're diagnosed, how soon will they start to feel better? Because that's really all they want, is to feel better.
That's what everyone wants to know. And you know, people always regret not coming in sooner, because generally once we start a program, we're going to do usually a series of treatments that are going to be 2 weeks apart. There's usually going to be 3 treatments, so it's going to be completed within a month. But usually after the very first treatment, these people are experiencing significant relief.
Okay.
And so usually it's very immediate, the relief that they're going to get. And that's not only with fibromyalgia, that's if they have severe lower back pain from disc problems, whether they have migraine or tension headaches, whatever the chronic pain issue is, generally the relief is going to come very quickly.
Is it shots? Is it a patch? Is it something you take internally? Is it different for every person?
It is different, but most of them are injectable types of treatments, and the goal is to shrink down the inflammation that is causing the pain. Pain is almost always generated from an inflammatory process, whether that's an autoimmune thing, whether that's an injury thing. You know, the inflammation can arise from different causes, but we're going to address that inflammation, shrink it down, thereby reducing the pain, and usually it's very, very quick that occurs. We have a non-steroidal medication that we like to inject. We also have a very diluted or low-dose steroid, which then allows us to avoid a lot of the steroid side effects that typically go along with pain management treatments. That's really what makes Novocur very unique in the Phoenix Valley. So, you know, very unique touch point for people.
All right, touch point. Because you're talking about the touch points.
The tender points.
The tender points with fibromyalgia. Thank you so much.
Thank
I know
you.
we got a lot of questions, so maybe we could just pass those questions along to you, and you guys
sure.
could
Yeah, we'll take
email
care
them
of
back.
them.
Okay, so Novocur Pain Management Clinics, they have 2 locations in the Valley. For more information, you can visit novocur.com, or you can call them at 480-855-NOVO, which is 480-855-6686.